You are officially invited. Yes, you. You're invited to join us in Fertility Awareness Mastery. This is my 10-week program designed to help you gain confidence using fertility awareness. Whether you're actively avoiding pregnancy or looking to optimize your cycles for conception, we have a spot for you. We start on October 9th. Are you ready to jump in? Head over to fertilityfriday.com/group program to reserve your spot today. That's fertilityfriday.com/group program. This is the Fertility Friday podcast, episode number 220. Welcome to the 220th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. Today, I share another episode of the Fertility Awareness Reality Series. And in today's episode, I interview Maria, who was a member of my most recent Fertility Awareness Mastery Group program. So this is the group that was meeting over the summer. And at the time that we're releasing this episode, we're actually almost concluding our time together. So it was a really great group. It was really nice meeting over the summer. And one of the things I really appreciated about the group was that there was a nice mix of women. So some of the women in the group were actively trying to conceive while others were actively avoiding. And so that generated a lot of really great conversations just around the method itself and different ways to use it. Even when I was talking to Maria, we had a session, just a private session that's not going to be aired, but we had a private session since we recorded this episode that's airing today. One of the things that she mentioned is that, she's actively trying to conceive. And so she really appreciated hearing some of the sessions with the other women in the group who are avoiding. She was like, well, whenever you say don't have sex on those days, she's like, those are the days I know I need to have sex on. So we were sharing a little joke there. So it's pretty funny. But at the same time, it is nice to kind of expand and see the different challenges, different questions, the different experiences that other women have with the method, because it really speeds up the learning curve. And so we still have a spot for you in the upcoming Fertility Awareness Mastery Group program. So we're starting in October. Make sure to head over to fertilityfriday.com/group program so that we can reserve your spot. So again, that's fertilityfriday.com/group program. Now let's jump into today's episode. And I'm very excited to introduce my guest, Maria, to the show today. Maria is part of my current Fertility Awareness Mastery Group program that's been running over the summer. So at the time of this recording, we just finished week 6. So we're well into our time together. And so Maria's had a chance to record a couple of charts with this new method. And in today's episode, we'll be going through, I know there's a couple specific things that we'll be talking about today as we were talking about the pre-chat. So welcome to the show, Maria.
Oh, thank you very much, Lisa. I'm very excited to be here. I'm fangirling right now because I've been a faithful listener to your podcast for so long. So this is very exciting.
Well, I'm happy to have you on the show. And before we get into a lot of the charting questions that we're going to go through today, I'd love to just hear a little bit about your history. So, when your period started, if you've ever used hormonal birth control, and basically what led you to jump into this program at this time?
So I started my period when I was 13 years old. And I was I don't know why, but I was excited because a lot of my friends were, and I was kind of feeling left out if I wasn't starting. So when I finally got my period, I was very naive and very excited for it. And the first couple of months it was fine. I didn't have very much cramping. I just bled a little bit. It was pretty light. And then it seemed after just maybe 2 or 3 months of having a nice light period, then it started getting super, super heavy. I would bleed for 7 days straight, lots of clots, intense cramping, and then I started getting some really unpleasant GI symptoms too. I would have vomiting and diarrhea during my period. I started to miss school, and I kind of went through that for a year before I really did anything about it. And I was always really anxious to go anywhere because if I was going to start my period, then I was going to get ill. And I just didn't want to be, away from home or anything if I was going to start. And I remember I took a trip to British Columbia to visit my aunt and uncle, and I started over there, and I was so miserably sick, and I didn't have my mom. And I just it was really affecting my life. And like missing school I couldn't miss that much school all the time, like every month. So when I was 15, actually, it was probably like 2 years of that. My mom took me to the doctor, and just like my general practitioner, who was a man, and like, that's fine. Sometimes men know, lots of stuff, but sometimes they don't. And he was just like, oh, well, we'll just get you on birth control. Like, that'll solve all your problems. And I was starting to get acne and stuff. And it was like, yeah, get on hormonal birth control, go for it. So I started on one that was called a less, I think, but I didn't find it made any sort of a difference. So then I switched over to tricycline, which made more of a difference. But then I still, like, the periods that I was getting, they weren't as bad. Like, I wasn't vomiting diarrhea anymore, but it was like still intense pain. So then I went to seasonal, and I just like kind of kept taking it, and then like never had a period. And I thought life was great because I just never had to go through that awful like illness every month. I, could go away. I could go on trips. I played volleyball. Like, volleyball uniforms are like little tiny like spandex, and like I never had to worry about like any kind of, like accident like happening on the volleyball court with my period. Like, it was great. And I was on that up until like from say like, 15 when I started hormonal birth control up until I was 23 when I got married. And my mom and her twin sister had really hard struggles getting pregnant. And I've heard, I don't know if this is accurate, but I've heard that women take after their mother for their fertility. And I don't know if that's a myth or if there's any truth to that. But because my mom and her sister had so much trouble, my husband and I decided that I would come off hormonal birth control like right away, like as soon as our wedding was over. So that was 3 years ago. And I went about a year with like nothing, no pregnancy, nothing. My periods came back just as they had before, like when I was 14, before I went on hormonal birth control, like really heavy, really long, GI symptoms, really awful, cramping to the point where like I would stop in the middle of my tracks and like have to like stop walking and like kind of crouch down. It was that painful. And so then a year went by, I didn't get pregnant. So we started doing some investigation. I had some blood work done. My FSH was a little bit elevated. I think it was 9. So they told me that wasn't like terrible, but it wasn't good for a girl my age, like at 23. And my husband had a semen analysis, which I think we'll probably talk about later. They told us it was fine, but I don't know if it actually was. And then I had like an HSG and my tubes were clear. So I started on Clomid, and on my 3rd round of Clomid, I actually got pregnant, but I miscarried at 6 weeks. So that was very disappointing. And then the very next cycle, I wasn't on anything and I got pregnant again, and then miscarried at 8 weeks. And we were able to have like the products of conception tested like genetically. And it was a female, and she actually had like 3 copies of every chromosome. So like trisomy everything. I think it's called like triploidy. So it was like definitely, they said, an egg or sperm quality issue, like something in the process of like maturing the egg or sperm, it didn't eject one set of chromosomes. So like one of them gave 2 when they should have only given 1. So then that kind of tipped me off to maybe there's like an egg or sperm quality issue with me. So after that, I was referred to a fertility clinic about 4 hours away from my home. And we went there, and they basically said that they felt that I had like a low reserve, and that it would be very rare for me to actually get pregnant on my own again. Even though I did, they said that was kind of like a fluke. So they told me like not to bother with IUI, just to go to IVF. So I did that, and I started taking like, egg health supplements that, are recommended. And I actually had like 11 eggs retrieved, which was great, but then only 4 fertilized, and then only 2 made it to day 5. And I've since transferred both of those, and neither of them resulted in a pregnancy. So now I just kind of decided, like, as we save money to try to do IVF again, I was like, I need to take control here. Like, I have to, learn about how to like maximize my chances on my own. I want to learn about my own health, my own reproductive health. In the midst of all that, I've had a few positive cervical biopsies for CIN2, like abnormal cells. So I just was like, you know what, I just kind of need to get back down to the basics and, learn about my body and try on my own for a little while. And I had discovered your podcast when I was first going through IVF about a year ago, and I've listened to it faithfully, and I've heard about your mastery groups. And I was like, after my recent embryo transfer failed in May of this past year, I was like, okay, this is time. I got to jump in. I gotta get, more body literacy. So that's why I joined, and I'm glad I did.
Well, thank you, Maria, for taking us through. That's a lot. I mean, I think I always say this when I'm listening to story, but you took us through 11 years, basically 11 or 12 years of your reproductive history within a few minutes. And even it's profound just to think about it, because you mentioned you were married at 23. So you've been trying to conceive for 3 years. And so when you were taking us through the different procedures that you've had done and the different testing that you have done, that brings us to now, which is you're 26. So you're quite young. And so it's in a way, and when I think about it, I just think it's just so heartbreaking, because you're so young to have to have had to go through so much already. There's one term that you used that for the listeners, use CIN. So that is a acronym for, it basically means abnormal cervical cells, just in case someone wasn't sure what that meant. And so I have a question for you. As we were going through, as you took us through, at this stage, have you ever worked with a naturopath or a doctor who was coming from a functional perspective, or has your experience only been with medical doctors and fertility specialists?
Yeah, I have been working with a naturopath, actually. I should have probably mentioned that in my journey. She's wonderful, and she's been helping me out a lot with like different supplements. I get acupuncture from her. I kind of was doing it like on a bi-weekly basis, and then like before and after my embryo transfers. So she has been wonderful. And I just felt like it was interesting. I felt like when I talked to her, it was the first time that I ever felt really like listened to, and that someone was looking at like the whole picture of like even like my stress levels, like everything. Like I just found it was very like therapeutic for me to see a naturopath, and it's been a great experience.
Well, and so a question that I have to ask is, given the intensity of your menstrual symptoms, so one of the questions I always ask, and I'm sure you've heard me ask this in the group a couple of times. So on a scale of 0 to 10, 0 being no pain and 10 being what you described, like intense vomiting, but basically feeling like someone's stabbing you in the abdomen. So typically when your period comes, where are you today?
Yeah. So as far as like pain, I feel like now it's almost like between like a 6 and an 8. Like if I hadn't had my miscarriage before, I would have said 10. But when I miscarried the second time, that was like a true 10 out of 10 pain. Like I've never felt anything that painful before. But now I would say like 6 to 7. And it almost feels like the way that I describe it is like pretty graphic and awful, but it's almost like a man like reached in to my body and it's like grabbed my uterus, and it's just like squeezing it, like wringing out a dish rag. Like that's how like I can describe the pain.
Oh, that just makes my heart sink. So when you have, the reason I asked that question, is because if I don't, then my experience has just been that, especially if you've experienced this type of pain from day one, to some degree, we just naturally minimize it because this is your quote unquote normal.
Right.
In one of I'll link to the episode with Molly Dutton-Kenny, because in that episode, she actually talked about, she's a doula, and she talked about the different ways women experience miscarriage. So sometimes we experience miscarriage like super, super painful and like just basically like a horrible period. And then other women will sometimes experience a miscarriage like they don't really feel it much and something will just kind of come out. If you hadn't experienced a miscarriage, you would have characterized your periods as a 10. So I just want to honor the fact that whatever you're experiencing is really bad. And your 6 to 7 might be someone else's 9 to 10.
Yeah, exactly.
Okay. I just want to put that out there. Has anyone ever said anything to you, or have any of your fertility specialists ever just put out the possibility of endometriosis?
It's funny because I feel like I have been trying to put that out. Like I've been trying to say, like, do you think I have endometriosis? Do you think I have endometriosis? And basically what they said to me was that if I did, it wouldn't matter because my tubes are clear. So they felt, I don't know if this is right or wrong, but they felt that the only reason my endometriosis would affect like my fertility was that it blocked my tubes, and my tubes are clear. So they basically kind of like swept that under the rug. Never mind that maybe I have it and it's causing me all of this discomfort. That really like didn't seem to matter. Just that my tubes were clear. So let's close that chapter and move on.
I think I'm going to be doing a lot of exhaling in our session. A lot of it. So if you weren't trying to get
I think so too.
just like finding my chi. Okay, so if you weren't, so one of my biggest issue, like literally the issue that's big enough for me to start this podcast and blab on about menstrual cycle for years and years. One of my biggest issues with what I'm hearing is that you're experiencing pain that is akin to, I'm not sure what it would be equivalent to in a man, maybe passing gallstones every day or having a heart attack. So legit.
Yeah, legit pain.
Yeah. So if you never wanted kids, like if this was a different conversation and we were having this interview and you weren't even trying to conceive, I would still be concerned about you experiencing that level of pain on a regular basis. So the fact that you're experiencing these symptoms, and because they assume incorrectly, my understanding is that endometriosis is one of the number one causes for infertility. And because of the way it could work, potentially where it could be, and it can cause certain aspects of your uterus and your fallopian tubes and your ovaries to adhere to each other. So there's different ways that it could affect your fertility beyond just the tubes. That's my understanding of it. So beyond whether or not it's inhibiting you to conceive, there's something going on there. That level of pain that you're describing is not normal. It's absolutely a sign that there's something going on. Just to put it out there, in a healthy menstrual cycle, when you have your period, yes, it is super common to have some degree of cramping or some degree of sensation. But when you're experiencing pain to the point that you feel like a man is taking your uterus and squeezing it back and forth inside your body, that is an indication of a really serious problem. And like, someone needs to say it, so I'm saying it. How does it feel just to hear that?
I appreciate your honesty. Like it's true. Like I always felt that it feels like I'm relieved because like I knew that all along, like that this couldn't be normal. Like women, like I don't think that this should be how it is. And, I think that sometimes like when we have like our tunnel vision on, like, it's just like, okay, like fertility. And we kind of don't look at like, maybe like my quality of life is being affected like by my periods. And maybe it is like hurting my fertility in other ways other than like my tubes. So, and actually it's funny enough that was actually one of my mom's issues with fertility. She had endometriosis. And she had like a lap and had to get it like, dealt with. And then I was a Clomid baby, but she had endo. So it just kind of, I don't know. I just always felt that might be something that's going on with me, but I'm, just trying to convince someone to agree with me.
Oh, yeah. I'm more exhaling on my part. So you have periods so bad that the way that you describe them is very compelling. You've had them since day one. Your mom had endometriosis, had to have a laparoscopy, and needed Clomid to conceive you. And at no point did anyone say, maybe.
Yeah. And like,
I'm not saying it is because I don't know. I'm not doing a laparoscopy on you today. But I mean, you have enough compelling evidence for someone to ask the question. So moving to more practical application of like, what can we do now? I would say, I'm not sure what's available to you where you live. I'm not sure the services that are available to you, but if you are having such compelling, if I know just from all these years of doing this podcast that there are professionals who sometimes listen. So there's probably like a naturopath listening right now, or like a acupuncturist, or even like a medical doctor. It often surprised me that I have been connected with medical doctors who listen to the show. So I'm positive that there are health professionals like right now who are listening to this episode thinking like, oh my God, like how could they have all of this history? So so I guess what I'm saying is it may be time just to consider like looking around to see what's available near you. So are there medical doctors who specialize in fertility who may have a a specialization with endometriosis? I mean, sometimes it's surprising to see what is
Um,
available around you.
I don't, right. And I think like, I don't know if there's anyone that like specializes in endo near me, but I should say I kind of like forgot about this because it was like a fleeting conversation I had with my gynecologist. But after I had done like 2 rounds of Clomid that didn't work, I asked her if, and she's my gynecologist is wonderful. I asked her like, you know, can we do a lap and just kind of see what's going on? And she was like, sure, like if that's, something that you want to do. But then I got pregnant like twice. So then that kind of like, it was just like a fleeting conversation that like we never talked about again because like, oh, look, I got pregnant and it happened again. And so maybe like there's no need to do that because it obviously wasn't blocking like an egg from coming. So then I think like the blinders were on and we both, I think just thought like, okay, well, no need to do a lap because I got pregnant and even if there's endo, who cares? So I think, but maybe now, like after speaking with you, I might try to go and revisit that and see if that's an option again, because like you've just sort of opened my eyes to the fact that it's still a problem.
Well, and I'm going to give you some homework. There's a couple of podcast episodes that are going to be the next ones that you that you listen to. Episode 18 with Dr. Rosita Arvigo. If you haven't listened to that episode, or even if you have, listening to it kind of with this new thought process would be helpful. There's a lot of different modalities for uterine, essentially massage or uterine therapy, where they actually go in and they'll, with someone who's trained in these types of procedures, will be able to feel if your uterus is in the right place. One of the characteristics about something like endometriosis, if that's what we're talking about here, is adhesions. I did an episode with Rachel Eyre several years ago, and it was a very interesting episode. So she was talking about what she called like the dancing uterus, I think, but don't quote me on that. I could be like mixing stuff up. But she did talk about how the uterus in its natural state should have freedom of movement. And she gave an example of a client who had an ectopic pregnancy, who had lost her tube, obviously devastating. But then she actually was able to conceive after that and have a successful pregnancy. And when the doctors took a look at, did the ultrasounds and kind of checked to see what happened, she had actually conceived with like the ovary that had ovulated was the opposite one. So, like not the side where the tube. So the uterus actually moved around and caught the egg. And so I thought, wow, like I'm just, that in of itself is like incredible. But the reason I'm bringing that up is because it gives you a sense that your uterus should have this freedom of movement. So to some degree, it should be able to actually move. I mean, it's not going to, on a vacation or anything, but it should have some movement to be able to move around there. And even we've spoken about cervical position in the group. And I always use my hand as the example of the uterus. And, the uterus does move. But if you do have certain adhesions or certain things that could be associated with something like endometriosis, it can prevent the uterus from having that freedom of motion. And so if you think about what would have to happen when you're having your period, like in order for it to empty, this may not be like the only answer, but it is something that could potentially cause the pain to be worse.
Right.
So
and I think like I have actually...
Oh, no, sorry. Go ahead.
Oh, sorry. I was just going to say, I think like I probably did listen to that episode that's really familiar to me, but I'm going to listen again. But I think that after I listened to that, I did look up practitioners who've done that. And unfortunately, I couldn't find any like in my area, but in Halifax, like 4 hours away, there are people that do that. So it would be interesting. Like, I mean, I travel there, on a semi-regular basis, like when I'm seeing the fertility clinic. So if it was something that, I don't know how many times in a row you have to have it done, or if it is like a once a week thing, that might not be practical, but I would like to maybe connect with someone up there and see if that's an option.
Yeah. I mean, it's hard because you have to base all of these things on what's available. It's just, these are things that, to try to just give you a few options and a couple ways to think about this. I mean, it's possible that some of the non-invasive options could make an improvement, at least in your comfort and your pain and all those types of things. So it's just worth knowing that they exist and trying to see if something like that might be useful for you.
Yeah.
And then something else, just as a question, have you ever tried castor oil packs, or have you ever heard of those? Or
yeah, actually, I have a good story about castor oil packs. So I used it once and it was great. Like when I was going through my frozen embryo transfer in May, you have to go and get your lining checked for thickness like a week before they will transfer the embryo, just to make sure that it's nice and plump and juicy, good little spot for the embryo to nestle in. And mine was actually far too thin. So they said, no, like we can't do this transfer until you like your lining thickens up a little bit. So they like, I think tripled the dose of estrogen that I was taking. But there's a really great support group on Facebook for women that are clients of this fertility clinic. And I typed in there like, look, my lining was really thin. They put me on more estrogen, but is there anything else I can do? Like I've heard of pomegranate juice, like I've heard of different things like that. So I was like, does anyone have any suggestions? And a bunch of women got back to me and they were like, castor oil packs, like you definitely have to do that. So I did one every night up until my next lining check for like a week. And I think my lining was supposed to be like 8 millimeters and it was 12. So I was like, woohoo. It was like, I thought like, yeah, that must have helped. And of course, like the clinic was probably like, oh yes, well, we did up your estrogen. I was like, I know, but the castor oil, I think that's what did it.
Yeah, we'll never know.
We'll never know.
But it's something to just, castor oil has an interesting history, and it's an area, like an interesting opportunity for more research to kind of figure out why it has the effects it does. But in terms of, like, it's implicated for improving circulation, improving liver function, which then helps, just to helps your body to process your hormones and all those types of things. But also it has implications with regards to scar tissue and adhesions and period pain and things like that. When you're trying to conceive, you want to kind of avoid doing a bunch of stuff after ovulation because you don't want to interfere with implantation or anything like that. But towards the beginning of your cycle, before ovulation, that's something to consider. So, getting some castor oil, soaking some sort of cloth that you will never use again because you won't be able to. Castor oil is really thick and messy. Saran wrapping yourself and then applying heat and just kind of hanging out there. Something just to consider for if it's something that appeals to you, it's quite relaxing, something that could potentially help. And that would be something that you could gauge. So you could kind of, try it and then see if it's actually doing anything over a couple cycles.
So should I do that like every day leading up to ovulation and then, so like even the days of my period as well, or after my period, but before ovulation, like which day should I try that?
I would say, avoid when you're fully heavily bleeding on your period because your body's kind of already doing its thing at that point. Perhaps days of light spotting or something like that, like towards the end. And then whatever makes sense. So if you want to do it for a couple of days, like a week leading up to it or something like that, you could just give it a try and see what works for you. Essentially, it's because of the way that you describe your pain, which would indicate to me that something like that could potentially help break up scar tissue or adhesions or something like that. And again, the most important thing is just for you to kind of monitor and see if it actually makes a difference. I mean, we're not going to do stuff if it's not working. But so let's switch gears a little bit. I definitely went down the rabbit hole when you started describing your pain, and given that you have been trying to conceive for as long as you have, and that's never come up, it's like, time out. We need to talk about the possibility of endo for a second. So we actually had a session in the group together yesterday.
I appreciate that.
You're welcome. I think there's a little bit of a delay, so the listeners will kind of hear that. It kind of sound like it's just the way the technology is. So we had a session last night and we went through. So I just pulled up your charts. Of course, the listeners can't see your chart, but just tell me, I know we wanted to talk about sperm quality today, so that's definitely, and the results of the sperm analysis, but let me know if there's any other topics that you wanted to make sure we talked about.
Definitely, like the semen analysis is one of them. I think like temping, like we talked about last night, was always like a nemesis for me. But other than that, like my main concern is like making sure that I time intercourse around ovulation like the best. I kind of get stressed about like if I like miss it, like say that if I we missed a day like before ovulation and like the next day I ovulated, I get stressed about like, oh, we should have yesterday, or I don't know, I just feel like I'm too worked up about the timing, and I just want to know from you like how much it matters if it's like on certain specific days, or if I do it every other day, is that good enough, that type of thing.
Well, I think so. That's a really good question. I'm glad you asked that, because it kind of points to some of the the common myths, I could say, the way that we think about the menstrual cycle. So typically, the way we think about the menstrual cycle, especially when you're trying to conceive, is that the goal is to have sex on ovulation day. So there's this idea that there's like a day and we have to have sex on that day or else it's all, you know, to pot.
Yeah.
So with fertility awareness, especially, you know, myself and other educators, one of the things that we try to convey is the significance of mucus over this ovulation day concept. And the reason for that, as you know, is because the actual day of ovulation does change from cycle to cycle. Even for women that have very consistent, regular cycles, they do not ovulate on the same day every cycle. And what really makes the most difference, what makes the biggest difference, is your mucus. So it's actually timing sex on the days of your mucus leading up to ovulation. So what I've heard a lot from my clients is like, okay, your doctor will say, well, from days 8 to whatever, have sex every other day. Or they'll tell women just have sex every other day, like infinitum. Yeah, from a physiological standpoint, you can only get pregnant from sex about 5, possibly 6 days leading up to ovulation.
Okay.
Yeah. So when it comes to timing, so I'm looking at your chart here. So in this chart, I'll try to describe it for the listeners. So you have your period, and then you have about 4 days where you didn't observe any mucus, and then you started having mucus. And so we talked about this last night. In your chart, we're seeing a low level of kind of lotiony mucus throughout. Mm-hmm. But as you approach ovulation, we are seeing in this particular cycle, you had 4 days of clear, stretchy mucus leading up to ovulation. So in terms of like, if we were looking at a strategy, you know, you've heard me say we consider all mucus fertile. But in your case, because we have this low level of non-peak mucus throughout your cycle, and you do have very kind of, at least in this cycle, you had days of very obvious, clear, stretchy mucus. I would say that when you see that very obvious, clear, stretchy mucus, those are the days.
Okay.
So we could kind of touch on the semen analysis. So when there's a lot of specific information kind of about how to optimize the sperm floating around out there. What I would say is that when you know that your partner has like a low sperm count or a low sperm concentration, then there is a potential, like there is a benefit to having him hold off on ejaculation for a couple of days before your fertile window, or to have sex every other day just to allow a little bit of time for the concentration to build up. But that is specific to when you actually have an issue, like you know you have a like you know that the count is a little bit low or something like that, and that just the like if you there's a we talked about this a little bit, like there's diminishing returns. So waiting for 2 weeks is not helpful. Waiting for maybe 4 or 5 days before your fertile window can be helpful, but you don't, like that he should, like men need to kind of ejaculate regularly just to make sure that the sperm is fresh and new and all that kind of stuff.
Right.
So in your case, let's kind of flip back and forth between your chart and the semen analysis. So I'm flipping to the semen analysis. We're looking at it now. Okay, so we have the sperm concentration. So concentration is how many sperm per milliliter. And so that gives us a good idea just of how many there are, right? Concentration kind of equalizes it because the actual total could be different if he, like every man isn't going to have the same volume of semen, but the concentration tells us like, you know, how much is in there. So 111 million sperm per milliliter. So the concentration is good. Like it's high. This is high. This is well above like average. And according to the World Health Organization, below like 15 million sperm per milliliter or higher, that's the World Health Organization has decided that 15 million sperm per milliliter is the low bar. So that's not optimal though. 15 million sperm per milliliter is not optimal, but that's the low bar. So yeah, so the concentration is really high. So it's like, good, we've got lots and lots of sperm. Yay, sperm. So the number that concerns me a little is the morphology. So 3%. And so I'm just going to pull up, again, the listeners can't see this, but I just want to show you a couple of pictures because it's easier that way. So what I'm pulling up here for Maria is a picture of like what normal sperm look like. So these are sperm that are dyed. So when you think of sperm, like that's what you think of. You think of like just a healthy looking sperm. There's a little head, there's a little tail. It's all great. But when sperm is like when the morphology is not normal, there's deform like so there's a varying range of kind of malformities of the sperm, but the head can be misshapen. There can be two heads. The tail can be misshapen. There could be two tails. It could be no tail. There could be no head. So when it comes to morphology, like it's helpful to know that the majority of sperm that men produce in general are not normal. So the vast majority of sperm at all is not like poor morphology. But that number just gives you a sense of like how many are abnormal. So if the information is correct here on the analysis, then 3 out of every sperm look like this. So 3 out of every sperm are normally formed, and then 97 out of every 100 look like this.
Oh, that doesn't seem good to me at all.
And I know you mentioned before we had the call that basically you had it done, and basically you were told like it's totally fine, everything's normal, everything's great. And so I would say that the reason when the concentration is so high, then they know that there's like a ton of sperm. So they don't really look too much at the morphology number, because it's like, well, if there's so many sperm, then that does mean that there are more normal ones than if the sperm concentration was really low. But in terms of volume, the vast majority are not capable of fertilizing an egg. And you mentioned at the beginning of the call a concern regarding the tests they did when you had the miscarriage. So we don't know, but I would just say like the World Health Organization has decided that 5% morphology or 4% morphology is like the low end of normal, like the cutoff. I mean, 3 is below 4, but even it's arguable that is 4 optimal for natural conception, or is it just the baseline bottom number that they need in order to get enough sperm to do an IUI or an IVF?
Right.
Yeah. This is something like we've talked about a lot of things in this session. I think the next time you have an appointment with your naturopath, I feel like these would be important questions to ask if she has any suggestions, and maybe even make an appointment for your partner and see like, are there any suggestions for what could be done to improve sperm quality? How you could specifically just talk about it. Like, is this, do you feel like there's room for improvement here? And what can we do to improve that? Because you mentioned you're taking lots of supplements to improve your egg quality and things like that, but this is a team effort, team sport.
I put him on supplements, actually. I have them right here. I just told him, I was like, hey, honey, take these. It's from a company called the Ad Tech, and it's called Fertile Pro for men. Yeah. So he takes these a day. So I'm hoping that, and that was before I even knew there was anything wrong. I was just covering all my bases. I was like, you're taking these from now on, and he was agreeable. So it was, so hopefully that's helping, and I didn't even know, because he started taking those supplements after that semen analysis was done. So maybe if he did one again, it would be better. I'm not sure.
Yeah. Well, I think that it's in the same way that as women, we talked a little bit about this in the group as well, but what I've found observations, and I'm sure you can attest, is as women, because we carry the babies, and because it's very involved on our part, we just take all of the responsibility. So whenever I'm working with somebody who is trying to conceive, I mean, all the supplements, all the doctor's appointments, I mean, all the charting, right? We're just kind of going at it. And I suppose the reason that we have these types of conversations together is just to highlight that even if everything is fine, I mean, the health of our babies is based on the combination of my contribution and his contribution. And so there's no reason why he shouldn't be kind of optimizing his own health, because it does make a difference. And so his contribution can contribute to your risk of miscarriage, and can contribute to it contributes to the genetics, right? So it can make a difference. So exactly. If the morphology is poor, it's something you need to know about. And also, the next time you're in with your fertility specialist, just ask some questions and just say this is something that I noticed on there. Is this okay? Is this normal? Is there anything we can do to improve that? And just, you mentioned that your naturopath does acupuncture. Again, these are things just to consider also for his side. What can he do? Even an increase. So imagine 100 million sperm, an increase of 1 or 2% morphology, how many more sperm is that, right?
Yeah, it's a ton.
Millions. So it's something
Millions.
to think about. Yeah.
Yeah, that's good. I'm glad that we talked about that, because I sort of didn't even really look at that analysis in depth. Like, I just heard that there was like no male factor that's like kind of the statement that they gave. And so I just kind of took that and ran with it. So I'm glad that we went over that, because that was really an eye opener. And I had like a huge epiphany in one of our last sessions together, the mastery session, when one of the participants said that she just found out that her husband's calcium channel blocker could potentially be affecting his fertility. And my husband's on a calcium channel blocker. So that's another thing.
Just for the listener, so that calcium channel blocker is a medication for high blood pressure. Is that correct?
That's correct. Yeah.
Yeah. And interesting, right? Because then there's this morphology issue. What if it's related to that, right? So yeah, like that's why I just like having the time to kind of just have a discussion, right? You have test results, like just take 5 minutes, talk about what it really means. Hearing it's totally fine is not enough information.
Yeah.
You need more information. Even if it's totally fine, I feel like you would it's still warranted to have a conversation to say, okay, this is the concentration, this is why it's fine, this is the motility, this is why it's fine, this would be a problem if it was like this, but this is okay, and then this is the morphology, again, this is optimal, this is why your results are okay. Like, that doesn't even take that long to go through and just explain so that you at least understand, because we just live in this culture that does not even consider that men could be playing a role in this, and therefore there's like an inherent bias to, oh yeah, he's fine, it's you.
Yeah. Exactly.
So let me just circle back. So we were talking about your chart and timing, and then I wanted to just touch on the semen analysis, because in your case, there's no issue with concentration. Holding off on ejaculating, for example. So you probably remember that when your husband did have that semen analysis done, they asked him not to ejaculate for like probably up to 5 days or something like that.
Right. Yeah.
So that, like, the purpose of every other day or holding off for a couple of days is to build up that concentration. So in your case, the concentration is not an issue. He's got lots and lots of sperm. So that's something that you wouldn't necessarily need to stress about.
Okay.
Yeah. I mean, you could do every other day, but you could also kind of do every day that you have peak mucus.
Okay. That's good to know.
Yeah. Like this would be something where, like, I just, in your, if it was, like, if the analysis said 20 million, keeping in mind that would have been after 5 days of holding off, then I would say, okay, but in your case, because this is not an issue of concentration, I say we can probably just not worry about that at all and focus on other things.
Okay, perfect.
And you are timing correctly.
Okay, thank you. Except and something I could have done differently, maybe a chart in the future, is like the days that you see that are skipped, I could have just not skipped them.
Yes, but I think by now you've kind of got a sense of, I'm not into this whole concept of perfection, right? As long as you're hitting those days of peak mucus, I mean, if you miss one, so what? It's okay. We don't want to add more and more stress, because life happens. Sometimes your partner has to go out of town. Sometimes you had a fight in the morning and you don't I don't know. So this is life, right? So I would say, just in general, there's no, like, you have to hit every day. Like, no, just when you see peak mucus, that that's the time. Try to hit some of those days. And the biggest thing from my perspective is, keep having sex until you've confirmed ovulation. So we talked about that quite a bit in our session yesterday. Like mucus, so the mucus drying up, cervical position, so the position is changing, temperature, so that the temperature shifts. When you are convinced with those 3 signs that, okay, these are all shifted, I'm fairly confident that I've ovulated, then you stop, like, for the purpose of trying to conceive.
Right. Yeah.
Yeah. But not in general. I'm a big fan of sex, and especially my biggest one of the things I love the most about fertility awareness is that it narrows that window of having to try. Right. So you're having sex and you're doing it for a reason.
Yeah. So and then, that's like, kind of like been stressful like after 3 years. Like it's sort of like at first when you first get married and like we're gonna try to have a baby and it's all like fun and exciting and romantic, and now it's just like, I don't know, like it's gotten like a little, I mean, obviously we still like enjoy having sex with each other, but then sometimes it's like I'm ovulating and he's like, oh really?
Man. Yeah.
So after 3 years it gets to be like stressful.
Yeah. Well, and not to downplay that. I mean, but I think all of my clients who are listening to this episode right now will have heard me say this already, which is that utilize all of the benefits of fertility awareness. Utilize the fact that there is only about 5 or 6 days or so basically like a week max, where you have to have that like fertility focused intercourse, right? Like let's use the scientific term. So outside of that, if we look at this cycle here, there's like at least 2 to 3 weeks of opportunity to have sex with no expectation of anything. Like no having to keep your feet in the air, like no having to think, because I know, okay, we should do it in this position. Or, there's all this stuff that goes around when you're trying to conceive in your head. Yeah. But when you're outside of that window, you can just not do any of that and make your reassure your partner that he's not just a sperm donor.
Right. And I think sometimes I like seem to come across like that. Like, like I'm like, I don't care if you're tired. I don't care if you worked all day. Oh, you're on call. It's 3 a.m. I don't care. Come on. Like, it's just like, I've gotten a bit crazy. And that was one thing that I wanted to ask too about, like, how important is it to like not let anything leak out afterwards? Because I find sometimes like no matter how much I try to like prop my pelvis up and like keep my feet in the air or whatever, then sometimes like it leaks and I just get like so stressed and I'm like, oh my God, like I lost it all. Like this is all for nothing. Like I just always feel really stressed if that happens. And I don't know, I just sometimes like afterwards, like I even sometimes like have to make my husband like leave the room because we laugh a lot together. And if he makes me laugh and then it all just comes like leaking out and I'm just like, leave me alone, like just lock me up in a dark room and so I can keep this in for as long as possible. But I mean, like so many women get pregnant that don't mean to, and I'm sure they're not laying down and like propping their pelvises up. So I just wanted to know like your opinion, how important is that?
Well, so this is that's a very important question. It's a big topic because let me think of just how to approach it. I suppose the first thing that is important to consider is that the reason that you and your partner haven't conceived successfully within the last 3 years, it's not for lack of you laying on your back. So I think, yes, like that's not the key ingredient that's going to make anybody pregnant. And this is because fertility challenges are really complex. So in our conversation today, we've identified a couple kind of big possibilities. Like we've got some big rocks in this equation, right? We've got the sperm quality, question mark. We've got endometriosis, question mark, right? We don't really know to what extent those are affecting it. But when you have a couple who is not conceiving from sex over a long period of time, there's something else going on there, because you're exactly right to say that, 2 healthy people without any type of challenges could conceive from too much like semen on his hand touching her cervical mucus. Yeah. Not even having the sex. Right?
Yeah, and that's like you spend your whole like youth worrying about that. Like, you know what I mean? Like as like a teenage girl, you're like, get the thing away from me
because you can.
If I looks at me, like just,
it like hashtag true story. Like it can happen with no sex, with just touching semen to mucus. My comment on that is that there's nothing wrong with kind of relaxing and hanging out after sex and kind of just encouraging that, but anything beyond like 15 to 20 minutes, like you said, no matter what, even if you're like, unless you have an apparatus in your house by which you can lay upside down or whatever, like hang upside down, like it's just not going to, it's not going to do anything. So if there's a legitimate issue with sperm quality, then that's something that you have to look at separately. But when it comes to just like, is laying on your back going to help? I would say that's not the strategy that we're going to look at. We need to look at what's actually happening. Like, what are those underlying factors, those big potential issues that could be interfering with fertility? So we'll talk more about that I think that's a topic we can talk a little bit more about in our group session, because we're actually kind of getting to the end of our time at this stage. But that's a really important question. And hopefully at least that gives some insight as to like, there's a bigger issue going on here. And laying on your back, given especially that your partner has like lots and lots of sperm, we've got huge concentration, like that's not the issue. There's something else going on.
Okay. That makes me feel better. So it leaks out like before the 15 minutes. I haven't.
Yeah, because it will leak out. Yeah, there's
right.
Yeah, unless you're gonna buy something that holds you upside down, it's gonna leak out. So, and it's just how it is. And again, imagine if you were 16 and trying to avoid pregnancy. Like that's not a way to avoid it. So there's something else going on.
No. Yeah, that's true. Yeah. Very true.
All right. Well, I just want to thank you so much for being on the show, Maria. Before we close today, maybe just share a little bit about what your experience was like in the program, and especially for a woman who's listening who's in a similar situation as you. There's many women listening who have been trying to conceive, whether it's for a couple of months or even a couple of years or more. So what, if anything, would you want to say to her?
I would just want to say just that, be your own advocate and do your research, and don't just take what, people say to you as gospel and then just kind of run with that. You have to do your own research, be informed. I know this sounds so cliche, but knowledge is power. And just if there's something going on with your body, research it, look it up, ask other people's opinions, look for, alternative practitioners that may specialize in the issue that you're dealing with. Talk to Lisa, get in the mastery group. I mean, this has been such an eye-opening experience for me. And just to know, I think there's 8 of us in the group. And I think the majority, I don't know if it's half and half, or the majority of us are half and half are trying to conceive and trying not to. But even the women that are trying to avoid, I'm learning from them too, because it's almost like I take the opposite. If you tell them okay, don't have sex on this day, I'm okay, that's when I have to do it. So it's just I'm learning so much. And I just think I'm all about talking and sharing my story and learning from other women. So I think it's been just a great experience. I'm really thankful for it.
Well, I'm so glad that we have you in the group, Maria. It's been a pleasure having you on the show. And I just want to thank you so much for being so open with your story, because I see the stats. I know how many women listen to these episodes, so it really is going to help many women. So I really appreciate you just being so open and honest and vulnerable with your experience.
Thank you so much, Lisa. I'm honored to be able to help someone else. So thank you so much.
All right. Well, I will see you next week in our next group session. So take care. Have an awesome week.
Thank you, Lisa. See ya.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/220. I hope that you enjoyed today's episode with Maria. It was really just a profound episode. I'm sure you heard just the passion and the concern really in my voice, and a little bit of frustration. I suppose a little bit is an understatement, but I suppose one of the biggest frustrations that I see, and I've had personally as well, is just the lack of concern for the intense amount of pain that many women experience during their periods. In the Facebook community recently, I posted just a general sense. I think I might post it again. I might actually do a bit of a poll or something so that there's more specific results and I don't have to go through and calculate everything. But I asked just a general question about your pain. So I asked the women in the group to rate whether, have you experienced pain with menstruation? How would you rate your pain on a scale of 0 to 10? 0 meaning no pain at all, 0 nothing, to 10 being that it's so intense that maybe it feels like someone's stabbing you, because I've had many women describe it that way, or so intense that you've actually vomited before. Now, for those of you who have never experienced period pain, it's almost unimaginable to just think about having so much pain that you need to vomit, or that you kind of pass out or something like that. But for many women, this is not an uncommon experience when they have their periods. And so, I'm really passionate about sharing that message that pain with menstruation that is that severe and that necessitates the use of drugs, or you can't function, that's an indication of a problem. And unfortunately, it's not a problem that is taken very seriously by many health professionals. I suppose it's one of those things where someone has to say that it's a sign of it's potentially the sign of something. Someone needs to say that you deserve not to be in such severe pain, and also you deserve to be fully investigated. So if you're experiencing pain that's that severe, it's important to seek support from a health practitioner who's willing to really look into it and do some investigation to really support you to figure out what's happening. And so that really came to mind after the episode with Maria after we recorded it, just because I just couldn't believe that so many years of experiencing the pain and so many years of trying to conceive unsuccessfully and not really having anybody look into that further. So if you're new to the podcast, or if not sure if you've heard this episode before, but I did an episode with Laura Bryden fairly recently, and that was specifically about period pain. And so that's a really great episode to listen to. Dr. Bryden, she really took us into period pain, what she's found works with her patients, and also really distinguishing between endometriosis, because often we think, okay, pain may be associated with endometriosis. Sometimes it is, sometimes it's not. Endometriosis is complicated, and some women have endometriosis with no pain. So that's episode 180. So fertilityfriday.com/180. Definitely an episode to listen to if you have period pain and you haven't actually listened to that one before. If you're looking for support with charting your own cycles, you've recently discovered fertility awareness and you're still trying to wrap your head around all of it, and you just want to gain that confidence in interpreting your charts, understanding what's happening with your mucus, understanding the difference between which days of your cycle are fertile, which days of your cycle are not, how to figure out what's going on with your cervix, how to figure out what's going on with your temperatures, if any of those categories apply to you, or if you're okay with the charting part, but there's just certain things, certain questions that you have about your cycle itself or about your chart that you just would like some additional support with, make sure to head over to fertilityfriday.com/group program and take a look at the upcoming Fertility Awareness Mastery 10-week group program. So 10 weeks, we meet every Tuesday. We're meeting Tuesdays at 8:30 p.m. Eastern. So we're meeting in the evenings, depending on where you are in the world, what your time zone is. And it's a great supportive environment for you to learn fertility awareness and really come out the other side feeling really confident about what you're seeing so that you can use this skill throughout the rest of your life. I think that's one of the reasons I'm so passionate about fertility awareness. I mean, you take the time and the money, to invest one time to learn about fertility awareness, and then it's a skill that you really have for the rest of your life that you can rely on, and you never really have to rely on hormones again. You can kind of leave them behind if that's what you're looking to do. So fertilityfriday.com/group program, we still have a spot for you. We'd love to have you in the group. So with that said, I just want to thank you for taking the time to listen to the show today. I really appreciate all of you for supporting the show. I say that every time because I really do appreciate it. It's really incredible just to see how many women are listening, how many women are in the Facebook group now, how many women connect with me and let me know what their experience has been discovering the podcast and what it's been like for them kind of discovering fertility awareness. And also the women that I am privileged to work with in the different programs that I offer. It's just been an incredible experience just to see how learning about your body can have such a significant impact on your life. So I love that you're kind of on this journey with me. I think it's really great. And I really do appreciate all of the support, and I appreciate all of you for sharing the show, for spreading the word, for leaving reviews on Apple Podcast, for, participating in the Facebook community. I just think it's nice to have a safe space to be able to really delve into fertility awareness and gain that confidence. So thank you all for being part of the Fertility Friday community. And until next time, be well and happy charting.